Welcome to Motors and Medicine. On today's episode, I'm going to be discussing seasonal allergies. Now, this is a concept that I think just about everybody is familiar with. A lot of people, especially where I'm from here in Utah, suffer from seasonal allergies. But seasonal allergies are a plague for just about everybody, just about anywhere in the United States, this time of year especially. So, just a brief overview. What are seasonal allergies? Well, they're sensitivities that individuals have to particulates and allergens that are in the air, primarily found in things like pollen from flowers, budding trees, grasses, ragweed, things like that. The problem with these seasonal allergies is that a lot of people don't quite manage them like they should, and therefore end up suffering needlessly for long periods of time during allergy season, and sometimes as a secondary result, end up developing sinus infections secondary to consolidation caused by these allergens. Now, I've gone over sinus infections in a previous video, so I'm not really going to get into that, but I will say this. If you manage your seasonal allergies properly, you can avoid a lot of these issues and mitigate any type of sinus infection from developing in the first place. So, as I was saying, these seasonal allergies, they typically start to get problematic right around March or so, depending on where you are in the country, of course. This particular year in Utah, we had a very extended winter, and plants, flowers, trees are not really budding yet because it's just barely started to warm up a couple days ago. Just last week, we had 12 plus inches of snow in April, so it's a little bit crazy. But nonetheless, allergy season starts right around now, early spring, and it can go through the entire summer and into the fall. And some people have pretty decent fall allergies as well, depending on what's budding, what's having a transitionary period, if we're talking trees and other types of plants and shrubs. But at the end of the day, these seasonal allergies all cause the same issue. It's basically just a consolidation and inflammation in the sinus cavities, throughout all the cavities in your head, making it difficult to breathe, causing headaches, runny nose, sneezing, achiness, watery eyes, itchy eyes, red eyes, you name it. Pretty much all those symptoms tend to be on par with these seasonal allergies. Some people suffer from them far worse than others, but I'm going to go over just a few things that you should be focused on to help minimize the inflammatory effects of these allergens and to try to minimize the onset of severe allergy symptoms and headaches. And then, of course, down the road, if you don't control them well, or if you just happen to suffer from allergies very badly, developing sinus infections, which can be very detrimental during the summer. Nobody wants a sinus infection during the summer. So, first things first, stay hydrated. Being hydrated is actually really important when you're battling allergies. A lot of people don't realize that. Number two, you need to get yourself a recent generation, or third generation, as we like to say, antihistamine. Whether that be Zyrtec, Claritin, Allegra, they're all from the same class. They're all similar generation. They all have similar effects. Some of those medications work better than others, but the main focus here is to be on some type of antihistamine that will help minimize some of the symptoms and not have the drowsy side effects. And of those three, Zyrtec tends to be the one that causes the most drowsiness, but in some cases, for some people, it tends to be the most effective. So take that with a grain of salt. The next, beyond getting on an antihistamine, is to consider getting on some type of nasal spray. Now, I always counseled people in the past, patients of mine, to use like a nasal spray that was saline based, just to try to keep the nasal cavities patent and clear. Now there's actually some nasal wash devices, apparatuses that actually work pretty well. One of them, for example, is I believe it's called Navage, where it kind of uses saline to rinse one side of your nose and it comes out the other, cleaning your nasal cavities. That helps mitigate a lot of the accumulation of the allergens and particulates from the allergens in your sinus cavities, causing inflammation. So that's something to consider. But if nasal sprays with saline are not quite cutting it or working, then the next step is to move on to like a steroid spray, similar to like say Flonase or Nasacort, something like that. These nasal sprays do have a small dose of steroid in them, but they do help fight off a lot of the inflammation associated with some of these allergies. So if you are one of those people that suffers from these allergies worse than your average person, then this may be for you, where you're using a nasal spray like Flonase or Nasacort or anything like that, just to try to reduce inflammation in the sinuses, okay? That'll help mitigate the sneezing as well as the inflammation, the runny nose, and the headaches that you get from that sinus inflammation. The next thing to focus on is trying to purify the air in your house as best you can. Now, most people live in homes that have HVAC systems that have filters, so you really don't have to worry about that. However, the filter that you're using does play a part. Some filters are better than others. It's actually better and advised to spend the money on the better filter that you can, one of the better filters you can get, because you want to try to trap those fine particles that get into your house and can, again, cause, these allergies to flare up and become an issue. You certainly don't want to be having allergies in your own house. And then the next step, just try to use some type of filtration device outside. And by that, I mean like a mask. If you're going to be in an area that's just super highly flooded with a high concentration of allergens, whether that be, up in the mountains if you're hiking through the trees, or if you're working in a garden, or, mowing the lawn, something like that. If you're going to be around something that's just a really high dose or exposure to the things that you're allergic to, wear a dust mask. These little simple dust masks, similar to surgical masks, work wonders in minimizing the amount of allergens that get up into your sinus cavities and cause problems. So if you do all those things that I just mentioned, you're going to be managing your allergies in a really efficient way. And if you can mitigate as much inflammation as possible, you will also minimize the onset of sinus infections, which are terrible any time of year, but in the summer is the worst, because nobody wants to be sick with an infection of their sinuses during the time when you're trying to be outside and enjoying yourself. So hopefully this information can help you out with managing your seasonal allergies. This time of year is terrible because everything's starting to just flare up. Everything is just, starting to bloom. Here in Utah, it hasn't been too bad yet. I've only had to take my particular antihistamine a few times just because it's just been, we're still transitioning from winter to, I guess, extended winter to, spring now, but there's really nothing that's budding a whole lot, nothing that's blooming. So eventually I'm going to have to be dealing with that problem as well, because myself and my family, we all suffer from these seasonal allergies. So take these tips into consideration. If they help you, I hope they do. And like always, please hit the like button if you saw that this content was beneficial. Hit the subscribe button, because a lot of you just aren't subscribed and you're watching the videos. Please subscribe. It helps the channel grow, helps me to be able to put out more content. And I'm going to be coming with more content on the medical side. But like always, I appreciate all your support. And until next time, this is Motors and Medicine signing off. Thanks.